I am so excited for today's video. I've never done one of these before, and I'm so over the moon. I'm going to be reacting to John Oliver's Medicare 101, and I'm so excited. I love John Oliver, and whenever one of these late night talk show hosts takes a gander at what I do for a living, I'm over the moon. I'm ready for them to roast the healthcare industry. I'm ready for them to roast insurances. It's all good fun, and I wanted to do this blind. I've never actually done a reaction video, so this is really exciting and kind of like a spur of the moment thing for me, but hopefully we can go through his Medicare 101 and I can provide some insight and some additional education of the history of our healthcare here and why Medicare is the way it is. So if you haven't been here before, hi, my name is Jennifer. I'm a licensed insurance agent, and you're going to watch me, a licensed insurance agent, react to John Oliver's Medicare 101 from his late night. So let's get started here. So iconic.
Our main story tonight concerns healthcare, ostensibly the subject matter of The Pit, which is slightly about healthcare, but much more about the gentle head tilt of Noah Wiley. On behalf of several members of my staff, engulf me in that hoodie, you casual Friday hero.
Okay, before we go into it, John Oliver, obviously he makes a lot of jokes, and sometimes he curses and he says a lot of lewd jokes. So if that bothers you, this is probably not the Medicare 101 for you, but I'm already in it. I'm going to turn, oh no, I'll leave the captions on just in case if folks need to see, you know, or see what he's saying. But I'm already excited. I'm so giddy about this.
Specifically, we're going to talk about Medicare, the federal program for those 65 or older or with qualifying disabilities. Now, open enrollment for it began on October 15th and will run through December 7th. And it's why this time of year sees tons of ads like these.
Hi, I'm Joe Namath. If you're on Medicare, this is important information.
Hi, William Shatner here with a new message about Medicare benefits.
Hi, I'm Jimmy J.J. Walker. If you're on Medicare, listen to this.
I'm Meredith Vieira. What's complicated and confusing that many people over 65 deal with each year? Medicare.
Correct.
Okay, this isn't the point, but the question, what's complicated and confusing that people over 65 deal with each year, is just too broad, given that the answer is everything. Everything confuses them. Have you ever seen a 70-year-old try to work an app?
Okay, look, I'm so excited. I hope he plays. I haven't seen this. This is an absolute raw live reaction to this. I hope he plays the infomercials. I can't tell you how many times my clients ask me, have you seen this commercial? It's about this medication or it's talking about like this service, and I'm over here like, no, because I'm working and I'm super stressed out about handling the amount of clients that I'm about to handle for this annual enrollment period. But yeah, just write it down, write the name of whatever medication you see or whatever service you see from the infomercial, and let me know. And some of them take me on this journey of it has a picture of a duck, and the duck is talking to this cow, and I don't know what these infomercials are doing these days, but you know what? They're engaging my clients, so they must be doing something right.
Apple TV remote. It's actually the reason Biden dropped out of the race last year. Apparently, his team handed him an Amazon Fire Stick right before that debate, and we all know what happened next. These ads are ubiquitous. One analysis found that in Medicare's open enrollment period a few years ago, over 500,000 ads like those aired on TV. That's over 8,000 a day. Normally, for an ad to be that overplayed, it needs to feature a child band singing a song that makes you want to commit mass murder. While they're often framed as being about Medicare, they're actually promoting something called Medicare Advantage. And that is different. Because while Medicare Advantage has the word Medicare in it, it is not what you may think. It's not health insurance provided directly to you by the government. Instead, it's a different system where the government pays private insurers, typically owned by companies like these, to administer your benefits for you. Honestly, it probably shouldn't have the word Medicare anywhere near it because it's misleading. It's kind of like the mountain chicken. Picture what a mountain chicken looks like in your head right now. Do you have it? You're wrong because it's this. It's a fucking
Oh my gosh.
which is just...
Oh my goodness. Okay, That's good. I would have to politely disagree with that. I think it is appropriately named Medicare Advantage because, as we talked about before on this channel, it can't be anything else. Because to get Medicare Advantage, you need to get Medicare A and B. That's just by, if it was separated, then you wouldn't need to get Medicare A and B. You would just be able to purchase a Medicare Advantage plan separately without your A and B, but you can't without it. So I would disagree with that. I would still call it Medicare Advantage because you can't get it without having traditional Medicare A and B. But I wonder if he goes over it, then okay, let's see.
Wrong. Mountain chicken sounds like, at minimum, a chicken that lives in the mountains. Or what a starving, stranded hiker would call human flesh. It's just mountain chicken. It's mountain chicken.
Oh my
it's definitely
God.
not Jeff. What it does not sound like, though, is this. That is a misuse of words. Anyway, the point is, thanks to blanket advertising and the fact some employee retirement packages offer these plans exclusively, more than half of eligible Medicare beneficiaries are now enrolled in a Medicare Advantage plan.
And it's going to increase.
Expected to grow to nearly 2/3 by 2034, which is concerning. Because these plans can have real issues. One expert has said the best candidate for Medicare Advantage is someone who's healthy, who see trouble when someone gets sick.
I would disagree,
but that is a problem. Because statistically, most people will get sick.
Correct.
It's just a fact of life. Like,
and there are plans dedicated to those folks who will get sick. Those are chronic condition plans. So he's not wrong. There are Medicare Advantage plans that are designed for folks who don't utilize their health care on a normal, regular basis, right? Like if you're somebody who doesn't have a chronic condition, then yeah, there's plenty of seniors that are Medicare eligibles that are like that. I have a couple of folks that are on give back plans because precisely they're like, I only go once a year for my physical, and that's only if I remember to go once a year for my physical. And there are folks like that. But then, on the opposite end of the spectrum, there's folks that have, really life-threatening, chronic conditions that I'm like, no, you know what? Whatever plan you're on right now and whoever is your provider, stick with the plan. Do not switch. And there's clients that I have rejected in the past because I told them, like, during mid-treatment, don't you dare think about changing. Do not change. Wait until your treatment's over. Wait until your providers are done with your overall continuum of care, and then you can come back and then we can reevaluate your plan. So I've heard this statement a lot, and I think it's a very misleading statement when you don't study and you know what is available for every single client.
Most cats hate you, and if Jeremy Allen White is on screen, he is sweating. Acting is sweating. We all know that. And that's by no means the only flaw here, because as you will see, while these plans can be great for companies' bottom lines, they can be woefully insufficient for those who signed up for them and the providers who have to deal with them. Medicare Advantage basically has all the problems of private insurance, but applies to a more vulnerable population. So given that, tonight, let's talk about Medicare Advantage, what it is, what the coverage can be like,
I'm so excited,
and whether you or someone you know should sign up. And to understand it, you first need to understand how Medicare works, which already isn't easy, because as you'll know, if you've ever enrolled in it yourself or had to help someone else do it, it is fucking confusing. On a scale of 1 to Inception, it is basically a tenet, and I don't say that lightly. To put it very simply, Medicare currently has 4 components, Part A, B, C, and D. Part A covers hospital and other inpatient care. That's what you've paid into your whole life. And for most, you can enroll at 65 with no additional premium due. Part B covers doctors' visits and outpatient services.
Or 40 quarters.
You do have to pay a monthly premium for that. That's
every American has to pay that Part B.
Social Security check, and even then, it only covers 80% of your costs. So the remaining
you are on the hook for 20.
You have to pay for out of pocket. But you can by a separate Medigap plan to cover that, which typically
Expensive.
costs $200 or more
Yep.
a month. And that
And
gap
that's starting.
is something ads
Starting.
pushing Medicare Advantage like to highlight, like this one featuring Kelsey Grammer.
Doesn't look good. He's missing 20%. He should have got better insurance. Fingers crossed. Are you missing 20% too?
Oh my God.
Your Medicare insurance might not pay for. That 20% is critical to your health care and your wallet. See, original Medicare only covers about 80% of your Part D medical costs.
Correct,
The rest
yes.
is up to you. It can be thousands of dollars right when you least expect it. So let Coverance help find a Medicare insurance plan that doesn't leave you so exposed.
Okay.
You stop it right now, Fraser! Though, to be fair, that is not the creepiest thing he's ever said about the medical profession, given his memoir features the quote, "Nice girls made me really nervous, claustrophobic, but broken women, women in pain, women looking to be fixed. Ah, for these women, the doctor was in."
No!
That is on the back cover, and it is wild to publish a book where you essentially argue, if you fuck me, you might need professional help.
Oh no!
Anyway, that is Part B. Now, if you want prescription drugs, and if you're a senior citizen, you definitely do, you need to pay for a separate Part D premium,
Correct.
which helps cover those. And that leaves us with
we've talked
Part
about
C,
it before. We've talked about it before. Part D is not offered to you by Social Security. You do need to go to a private company that sells Part D prescription drug plans, and you will get hit with a penalty if you do not sign up for a separate prescription drug plan. Remember, it's 1% for every month you do not have the prescription drug plan, and that's a lifetime penalty. You will not escape it. It is for life. So that's important to note. A and B are Social Security. Part D is a private company, but let's see what he says about Part C.
is Medicare Advantage. It functions as an alternative to all the other parts in that it helps cover hospitals, doctor visits, and usually drugs, while offering often extra benefits like some dental, vision,
Correct.
and hearing coverage,
Yes.
or even debit cards to help pay grocery bills. And it does all of that.
Yes, because remember, A and B does not cover for dentistry, optometry, or hearing aids. So if you have A and B and you need glasses, which pretty much everybody over 65 needs glasses, almost everybody needs glasses. Everybody needs dental care because dental care is connected to the physiology of how you're doing with your entire body. So everybody needs those plans, and Medicare A and B does not cover for that. And the only thing that covers it really is Medicare Advantage, unless you purchase a separate dental, vision, hearing plan if you did not want to do Medicare Advantage.
For a relatively low upfront cost, as other than that standard premium taken out of your Social Security check, over 3/4 of enrollees pay no additional premium at all. So it is pretty appealing on the surface.
Correct.
And while I don't have to show you one more ad for it, especially as it basically recaps everything I just said, I'm going to do it anyway, because it is magnificent.
I love him.
Al, did you make that call?
Honey, we already have Medicare. Why do I need to call?
Alan, the Feldman said we may be able to get additional benefits with a Medicare Advantage plan right here in our zip code with $0 monthly premiums.
Honey, what do you mean additional benefits? We turned 65, we got Medicare. That's all there is to it, right?
I'm talking about Medicare Part C, commonly called Medicare Advantage. We have traditional Medicare, which
This is
only
amazing.
Medicare Parts A and B, but not Part C.
Wait. So not everyone on Medicare is a Part C plan?
No, that's why we need to call, because there may be plans available with additional benefits that aren't covered under Medicare Parts A and B. We don't have a Medicare Part C plan which covers everything in Part A and Part B plus extra benefits in Medicare Part C.
What kind of extra benefits?
There are great plans that may be available with extra benefits
This
like
is
dental,
so fabulous.
vision,
I
and
love
hearing.
all of this.
Did you say dental?
That is, and this is true, only the first half of that commercial.
That's only half of the commercial?
Level acting,
Oh my God.
Wild physical gestures.
Oh my
The
gosh,
totally
stop.
unnecessary undercurrent of a broken marriage, and the phrase "right here in our zip code." It is perfect. I also love the disclaimer
Lord.
saying "paid actor portrayal," As if we've been so sucked in by the natural delivery of concussed Rob Reiner and
This is
overcaffeinated
so
Amy
great.
Sedaris here.
I love it. I love these commercials.
Reminded.
Okay,
But
they're
the thing
entertaining.
is,
Come on
there
now.
are a lot of drawbacks to Medicare Advantage plans. For a start,
my career is so dry, okay? It is such a dry career. And when anybody who's approaching this age knows that anytime they have to go to the Social Security office is now, it feels like going to the DMV, and no one likes going to the DMV, so no one likes going to Social Security. And the fact is that this is so important, and the amount of people that I see every single year who forget or refuse to sign up for Medicare, who refuse or forget to sign up for their prescription drug plan, the penalties are just astronomical. It's astronomical. And so when I appreciate these ads, because the thing is, and I don't know if he's actually going to say it, but the amount of people that don't sign up or forget to sign up, it's too much. And listen, if these ads are making people remember, like, hey, you're approaching this time, don't let it slip you by, I think it's a good thing. I think it's a good thing.
But they come at an inflated cost to taxpayers, which is a bit weird, given that a big part of the argument for creating this system over 2 decades ago was that bringing in private insurers would help control cost. In fact, here is Orrin Hatch back then, one of its biggest cheerleaders, making his pitch.
Choice. The right to pick the coverage you want. That's what Medicare Advantage actually gives you. Now, there are those who believe that socialism is the answer to everything. Let government do it. Mm-hmm. Government can do it more efficiently. Well, if you believe that, you haven't watched the last 50 years.
Yeah, the whole argument was that this would expand choice and companies would do a better job at controlling costs than the government. And look, some things are better when the private sector's involved. Take novelty slippers. Only through competition.
I know he's making a joke, but I think, and I don't know, I haven't seen this, so I don't know if he's actually going to go through the history, but I'll give you the fast, quick, and easy of the history of why we don't have Medicare for all. If you remember our history, and it's not the past 50 years, it's the past 100 years. And especially because we're in 2025 right now. So if we go back 100 years ago, that was World War I. So, you know, what happened during that time? You know, we were in the roaring 20s. And, you know, it was prime time for America. But why was it prime time? Well, remember, America got off the gold standard at that time, and the Federal Reserve was open. So they were printing money like it was no tomorrow, which ended up causing the crash. Now, if you're a history buff and you want to correct me, you know, I'm doing the quick and easy version of how we got here and why we don't have Medicare for all. So in the comments below, go ahead. Every history buff, come and correct me. I'm just doing the quick and easy. So we were in the roaring 20s. Federal Reserve is open. We are off the gold standard. We're printing money like crazy. Everybody's spending money like crazy. But guess what? We then crashed because people went to go grab their money because they lost faith in the Federal Reserve. And then we went into the Great Depression. And what happened? No one could afford healthcare anymore because it was the Great Depression. The amount of people that passed because of famine, sickness, the Spanish influenza, you know, took out a great chunk of our workforce. Famine took out a great chunk of our workforce. No one could afford to see a doctor. We get into World War II, where the actual first person, the first president, and please correct me if I'm wrong, if any president prior to this actually made a comment about getting universal care. But it was actually Truman. Yes, that Truman dropping 2 atomic bombs in a country far, far away. That Truman was the first president to actually suggest that why don't we install universal care in our country, seeing how devastated the economy and the people were because they couldn't afford healthcare during the Great Depression, we should probably put in something in place, a safety net for our healthcare, so that folks, regardless of their income, can still see a doctor. But if we remember what else was around at the time, China was getting installed as communist China. The USSR, Soviet Union, also, waving the flag of communism. So Truman suggesting socialized healthcare at the time came at the worst possible time of all of our history because we went into the Cold War, the Red Scare. And it wasn't until 1961 when Kennedy started saying, hey, I kind of want to put in some socialized healthcare for our folks, just for our senior folks, just for our retirees. Got some pushback because we were still coming off of the heels of the Red Scare. Everybody saw that and said, this is socialist, this is a socialist agenda trying to come in disguised as healthcare. And it wasn't until, unfortunately, we all know what happened to Kennedy, gets assassinated, and then Lyndon Johnson takes the reins. And what does he do? 1965, he signs the bill. Medicare and Medicaid is now in place. Medicare for those 65 and older, Medicaid for low income. And I think originally, correct me if I'm wrong, it was originally for women and children or pregnant women. And then over time, it went into low income. So, and he barely got it passed. That was not a popular thing. They didn't want. And what I mean by they, I mean like the Doctors Association didn't want Medicare because they were saying like, how are we going to get paid? We spent all this time training our physicians and you're about to subsidize it? Does that mean, are we going into a socialist type of care where you're not going to pay us anything? So they lobbied really hard against it. The folks in government were, going about it saying the same thing, like, how are we going to afford this? But guess what? They made it happen. They passed it and they tried to figure it out. But just to get Medicare, the one that we have now was a fight. And the first person to get their Medicare 101, their Medicare card, like history buffs, hopefully I'm not, mistaking this, was Truman. Truman was the very first one because he was turning 65. He was the very first person to ever get a Medicare card issued to him by the government. So he was our very first Medicare beneficiary. So it's very interesting when you start learning why it is that we got here what we got here. It's a miracle that we even got Medicare for 65 and up.
In the free market, you get innovations like hairy feet slippers, creepy Marge Simpson slippers, Sigmund Freud slippers, Danny DeVito slippers, and
oh my God,
golden penis slippers. And if you're wondering who the fuck would buy those, you are looking at him.
Oh my
right
God,
here.
of course.
Why did I buy these? I don't know. Probably because of something deep-rooted in my psyche, stemming from my childhood, at least according to my Sigmund Freud slipper right here. But sadly, the private sector hasn't done as well with Medicare as it has with slippers, because these plans have never saved the government money. In fact, a report last year estimated Medicare Advantage had cost the government over the previous 18 years an extra $591 billion. And this is partly down to the fact the major companies involved need to make profits for their investors, and they have found ways to do that. One concerns how they get paid, because in traditional Medicare, a provider treats you and the government pays a fee for it. But in Medicare Advantage, plans get a fixed payment from the government for each member they take on, regardless of whether you get treatment or not. And
correct.
Crucially,
it's a capitated system
based in large part on what illnesses you're listed as having, because insurers are entitled to extra money when their patients are diagnosed with conditions that are costly to treat. Here's a report from several years ago explaining how it basically works.
The insurance company uses what are known as diagnosis codes.
Yep.
To report that
Correct.
person's level of sickness to the government.
Well, they pay one rate for plain old diabetes, and then they pay another rate for diabetes with complications.
Yeah, they do.
If you write down in the file that the patient has diabetes and has complications with eyesight or other things, they'll get paid a higher rate.
Right, and in theory, that makes sense. You want insurers to take care of sicker patients.
Correct.
Unfortunately, a lot of things that sound good turn out to be terrible in practice, like overalls on adults, or drinking a beerita, or buying a flight that leaves at 6 a.m. to save money. Oh, sure, seems like a good idea until you're at the airport at 4 in the fucking morning. But hey, at least you got to your destination by 10 a.m. and can't check into your hotel for another 5 hours. Aren't you glad you saved $35 on that ticket? Well, the same is true here, because the government paying more for sicker patients has given insurers an incentive to identify as many health conditions as possible for each enrollee.
And what he's talking about there is the health risk assessment. So that's something that I do fill out on behalf of my clients. And here's the thing about that. When you do traditional Medicare is not managed care at all. It is a free-for-all. It is a free-for-all, and I wonder if he's going to cover this, but traditional Medicare is really highly abused. A lot of industries and a lot of services prefer the traditional Medicare A and B because they can constantly bill it without supervision. And that was one of the things that, this year with the BBB, that was a talking point. Like, there's a lot of fraud in Medicare. Now, unfortunately, they kind of used it as a blanketed statement to cut Medicaid and all these other programs that, folks legitimately do need, without actually addressing these services within the healthcare industry that abuse and constantly bill Medicare multiple times without the management of it. And that is what Medicare Advantage is supposed to be. It's supposed to be managed care. It's supposed to be the HMO, the healthcare managed organization that is supposed to supply you a social worker, a concierge service in the event of an emergency, so that we can take down the cost of people ending up in the emergency department in order to get all of these qualifying conditions, so that you see a specialist and they manage you so that you can reduce the chronic condition you have, or they can operate and prevent something catastrophic happening to that person. That is what it's supposed to be in practice. Now, I don't know what he's going to say, but let's see what he says about this, because there is a downside to it. Don't get me wrong, and I'm very, very aware of the flaws in Medicare Advantage. And so let's see what he touches upon the flaws.
Potentially to then game the system. They can find lots of ways to add big money diagnoses to patients' charts through a practice known as upcoding. This happens
very common in
lot.
hospitals, by the way.
One investigation found that Medicare paid insurers about $50 billion over 3 years for diagnoses added just by insurers. Not only that, many diagnoses were added for which patients then received no treatment, and often neither the patients nor their doctors had any idea, which isn't great, is it? The whole point of a doctor is for them to diagnose you, or in my case, for them to look at me, down at the chart, look at me again, back at the chart, and then say, 48 years old?
Cute.
Are we sure about that?
Very cute. Okay, so that is something that, again, that is part of the health risk assessment. And I will say, not all insurance companies, but a vast majority of them are improving that, because they do send social workers, they do call the doctor's offices to confirm if the client does have a history of those chronic conditions. They are checking and double, triple, quadruple checking. Not every insurance company does it, but the good ones, the more stable ones, they end up doing that because they understand that, they are under scrutiny. A lot of these companies are under scrutiny right now, especially, we have a government shutdown because of healthcare. So they do it is a practice that is constantly improving, and it's good to call it out. It is good to call out the flaws because it's the only way we're actually going to improve and make it better.
And while insurers will claim they're just being thorough, they've been repeatedly accused of essentially pulling a Munchausen by paperwork. In 2022, the Times found 8 of the 10 biggest Medicare Advantage insurers had submitted inflated bills according to federal audits, and that 4 of the 5 largest players had faced federal lawsuits.
Correct.
Alleging that efforts to overdiagnose their customers had crossed the line into fraud.
Yeah.
And some have been accused of getting very sneaky to add patient codes. For instance, many tout home visits with ads featuring happy seniors excitedly greeting healthcare workers at their door. Here is how United Healthcare advertises theirs.
Oh,
Remember
Lord,
the good old days when doctors made
it.
house calls? United Healthcare offers their Medicare Advantage members an annual visit from a licensed clinician in their own home at no extra cost. Home visits may include a review of your medical history, a check of your vital signs, and a chance to talk about your health concerns. With house calls, being healthy starts at home.
Yeah, and you can see how attractive that is, not least because the senior gets a visitor, and you know how happy that makes them. The elderly love exactly 3 things: having guests, talking to guests, and then freaking out when that guest sits in their fucking chair. But an investigation found that in programs like that one, companies push nurses to run screening tests and add unusual diagnoses, turning the roughly hour-long stops in patients' homes into an extra $1,800 per visit on average.
Wow.
And while United will insist most of the conditions it's coded for in its house calls program haven't raised payments, some very much have. For instance, documents show its software would suggest the diagnosis of secondary hyperaldosteronism, a condition in which levels of the hormone aldosterone rise without requiring it be confirmed by a lab test. United Healthcare apparently diagnosed that nearly 250,000 times after home visits, leading to $450 million in government payments over just 3 years.
And here's what I will say. Here's what I will say to that. We're talking about one of the biggest companies in healthcare, right? This is one of the biggest, if not the biggest company, has the largest market share of lives in Medicare in the whole United States. And to me, I'm like, oh, $1,800. I know it sounds astronomically high for a visit to be $1,800, but, and for me, coming from a hospital point of view, because that's where I came from. I was a hospitalist prior to jumping into being a licensed agent. When you see the bill from a hospital, $1,800 looks like chump change. If that person, came into the hospital to the emergency department and then got admitted and needed additional services, when the $1,800 home visit could have prevented them from going to the hospital, I can see the argument. And the $246K number here, what I would say to that is United Healthcare has, again, the largest market share of Medicare eligibles. I think they have easily probably like 40 million people on their plan. Don't quote me on it. I actually do not have the numbers, but I know it's in the millions and they have the largest market share. For it to be $246K out of 40 million, and if it's a rare diagnosis that ends up, if there's documentation showing like, okay, these folks end up going to the emergency department, that emergency department bill is easily $8,000 plus. So it's like a give or take, right? It's a give or take, and it's one of those moments where it's like, okay, what does it actually show? Does this actually prevent? Does it actually save? That is what I do not know, right? All I know is, okay, if they're offering these services, hello, honey, hello. If they're offering these services in order to prevent people from going and running up a hospital bill instead, that's where the real question lies, right?
Although a former house calls nurse said, in a million years, I wouldn't have come up with a diagnosis of secondary hyperaldosteronism. And of course not. I didn't even know what hyperaldosteronism was before working on this piece.
Now that's bad.
And to be honest,
that is
I still don't really know much about it. Aside from the fact that you can
That is
rearrange the
bad.
letters to spell modernist horseplay, which
Oh my God.
isn't nothing, but it does feel close to it. Now, I have to tell you, United Healthcare claims that report misrepresents house calls, which is just about supplementing doctors' visits and identifying gaps in patient care. I presume that they're currently making that same argument to the DOJ's Criminal Healthcare Fraud Unit, which is investigating its Medicare billing practices, and I wish them the very best of luck with that. But they are not the only company who face these sorts of accusations. An insurer called Independent Health faced similar claims, including that a woman in one of their Advantage plans was apparently coded for prostate cancer because, according to an internal email, when a married couple has any disease, both were assigned to that disease. Which
That's
is both
not
ridiculous
good.
And also
That has to be called out. That does have to be called out. That is inappropriate.
Promise to take Doug's diseases from tip
That
to taint
is not
as long
helping.
as you both tell
There
me.
are legitimate
I do.
people. There's legitimate people out there that are really actually sick, and that needs, I'm glad he's calling them out. That is not okay at all. Absolutely not. There are legitimate people that I speak to on a daily basis that are suffering from real chronic life-ending situations, and for companies to be doing that kind of nonsense, no, absolutely not. And they should be called out for it. That is inappropriate.
Really do. Now, again, I have to tell you, Independent Health did not admit liability, but they did pay $98 million to settle that lawsuit. You know, the exact kind of thing you do when you're not liable for something. So at this point, I think it's pretty clear. These plans aren't a particularly good use of taxpayer money. But are they good for patients? Well, on the surface, cheaper premiums sounds appealing. And if you're relatively healthy, these plans can seem like the more attractive option. Just listen to this woman explaining why she and her husband picked one.
We are very active. I play pickleball twice a week. We have a big garden. We have animals that we take care of. And so we're always doing something. And we wanted to retire while we were still able to do things together. And that we liked the Advantage plan because it seemed to fit our needs for that.
Right, and I get that that makes sense for her right now, because from the minute I saw that woman, I knew she played pickleball.
Oh my God.
She didn't need to tell me that.
Okay, so I'm pretty sure he's about to make the argument of like, it's great for you now until age 96 or 100. And here's what I'll say to that. When folks retire, and you know, he keeps bringing up this is not good for taxpayer money. Remember, Medicare Advantage plans, like 95% of them come with a zero additional monthly premium. And when most folks retire right now, with inflation, with the cost of everyday goods being astronomical, the cost of rent being astronomical, and most folks who retire, you know, they don't have a pension. Most companies, like almost all companies, refuse and don't have pension offerings anymore. They have a 401k, not the same as a pension. But folks don't put into their 401k, and it's taxed, you know, when they take it out. They don't have private savings. And you see the monthly premium of Part B going up next year to over $200. For somebody who's relying on Social Security, they can't afford a supplement plan. Like Advantage offers the additional coverage of the dental, vision, hearing. And like I said, not every plan is created equal. There are chronic condition plans. There are institutional special needs plans. There are dual eligibility plans. There's give back plans. There's low premium plans. There are so many varieties of plans that help the need of the person. If, you know, not to make it sound like, oh, Medicare Advantage is our universal care for senior population. It costs the extra, but you know what? If our government is refusing to give universal care to all citizens, and if they're paying an additional $500 billion to take care of our senior population through these plans and to get the possibility of better managed care, I rather them pay that extra money and give some form of universal care, some form of it. Is it the right solution? No, it's not. Absolutely not. But is it the best that we have for right now for what we're currently dealing with? Absolutely. Absolutely.
And everything about her screams, I'll dink your kitchen, then cross-court lob until we bagel, because je suis la pickle bitch. And Medicare Advantage plans go out of their way to recruit people like her. Many even offer perks like gym memberships, which can be disproportionately attractive to relatively healthy beneficiaries. But once you get sick, you can find out your plan has a lot of limitations. For example, under regular Medicare, you can go to any doctor or hospital that takes it, which is most of them. But with Medicare Advantage, as with most private insurance, you can typically only use doctors in the plan's network and service area. And as those can change at any time, a doctor who is in network when you sign up...
Okay, so let me correct him a little bit here, because what he said is the nuance. And this is why I wanted to react. Yes, traditional Medicare A and B is the largest insurance provider of all the United States. Traditional Medicare. That is the largest insurance coverage of all of the United States. Hence why people are pushing for Medicare for all. When you sign up for an Advantage plan, you can still go to any hospital. You can still go to, it's illegal for hospitals to turn you away. So you can still go to any hospital and be serviced there. And plans do what they would call like an agreement, a one-time agreement. Yes, we're going to go ahead and pay for this person to go to the hospital because it was an emergency. Yes, we will cover it. Yes, we will cover you when you go to the emergency department because we know you're only going there for the event of an emergency. And they will pay it. What he's talking about right now is the HMO, right? So it's the HMO, and you can still go to any of these hospitals. What he's talking about is when you go to these hospitals and they do not like their reimbursement rate, or they don't like the plan that you're on, and so they will do things to try to get you out of the hospital as quickly as possible. I can only say that because I worked in a hospital, and yeah, that was a discussion. Hospitals have these discussions. Sorry to break it to you, but they do. And to say that this is all of insurance fault, that is where I have an issue, because it is not all the insurance fault. There is fault in our current system in the way that we're being reimbursed. There is a fault to the providers. There is a fault to healthcare administrators. There is a fault to the actual services themselves. We all share in this fault. And to just say it's just insurance is really short-sighted.
Can quickly fall out of it, and that can be a big problem. Consider this woman who had cancer and who qualified for Medicare due to disability, but signed up for a Medicare Advantage plan thinking that it would save her money.
I went for my routine checkup. I'd been a Dana-Farber patient since 2013, and I got a bill. They're saying the provider's in network in the building, but the building of Dana-Farber is out of network, and I'm not allowed to go there anymore, even though I'd been going there and had the same insurance. So after all of these years, I
saw this video
care to a different hospital because I can't go there anymore.
That is absurd. Her doctor was in network, but the building wasn't. It's one of those things that makes
because
your
the
brain
way
hurt.
the way it's being billed is not through the provider, it's through Dana-Farber. And that is something that most people, when dealing with Medicare and Medicare Advantage, they need to say that up front so that they know what they're signing up for. If Dana-Farber was the most important thing to her, then, and I'm not victim blaming here, do not get it twisted. I am not blaming her. There are so many people that this is so complicated. It is so beyond, oh, just choose a Medicare Advantage plan and that's it. No. This is where you need the guidance of a professional insurance agent. This is where you need somebody who knows the system, who knows your area, that can tell you up front. Here we have They have Dana-Farber. Oh my gosh. City of Hope. Here in Los Angeles, we have City of Hope, a dedicated cancer institute hospital. We have City of Hope. If somebody comes to me and says, I want City of Hope, I already know you're probably going to be on a PPO plan. I'm just going to be honest with you. You're better off trying to sign up for Medicaid or Medi-Cal here for California and be Medi-Medi if you're a cancer patient to go to City of Hope. Now, it doesn't mean that City of Hope doesn't take insurance. They do. They do take insurance policies. I just know they are very, very selective, and most likely it's going to end up being a PPO. If you really want those doctors, if you really want City of Hope. That's what happened here. She was not explained what her current situation was, and that is why she ended up not able to go to her hospital. I have to take a break. Pedro 4536. Okay. Hi Nelda, how are you?
Hi Jennifer. Are you with the claim?
I am doing a small video, but what's up? Yeah. Are they a U.S. citizen? Yeah, I can help them with the Part B. Yes. Yeah, give him my business card. Give him my business card. I'm going to be done filming in about 30 minutes or so I can reach back out to them in the next 30 minutes. Thank you. Bye-bye. Okay, between 45 to 47. Okay. Let me start on the 47 part mark so that it's easy for him to edit.
If you think about it for too long, like how gravity works, or why some people's bodies shit when they're scared, or how Bill Belichick's daughter was 17 years old the year his girlfriend was born. Some things are just too difficult for you to comprehend. But it can be genuinely hard to find someone in-network on an Advantage plan. And even if its list of providers looks good on paper, it can quickly collapse under the slightest inspection, as this man discovered.
I'm diabetic, so I looked under endocrinology. There were 4 listed, and the first 2 were at Schnuck's grocery stores, and they weren't endocrinologists. They were just pharmacies. So
that's pathetic.
Apparently, that means that they offer 2 endocrinologists in this 25-mile radius, and that has me hugely concerned.
Is that enough for the senior population here?
No.
Yeah, of course it isn't. And finding out half your list is just grocery store pharmacies
would
be frustrating, because everybody knows you don't go there for an endocrinology appointment. You go there to check your blood pressure in the machine that makes your arm feel like it's being squeezed by Paul Mescal's thighs. That is a thing that we all do. And that is not a one-off either. One review found the majority of Medicare Advantage organizations had between 30 to 60% inaccurate locations in their directories. But even if you can find a provider, you may then have to deal with something called prior authorizations. Now, you're probably familiar with them from employer-sponsored plans. Well, traditional Medicare almost always pays for the care your doctor says you qualify for. Virtually all enrollees in Medicare Advantage are required to obtain prior authorization for some services. While these plans are supposed to cover all medically necessary services that original Medicare does, actually getting approval can be a grueling process, as this doctor explains.
We have to call for a prior authorization, and we can't do it electronically. We actually have to call on the phone, the old-fashioned telephone.
Okay.
We have to call an 800 number, some number, and then we have to give them all the data. We have to give them the insurance information. We have to give them the patient's date of birth, things like that. And then what they do is they give us then an authorization to fax them the information. So I've called them to get permission to fax them a request.
That is
I've got to call them while they
obnoxious.
discuss the fax. That's another barrier and obstacle to care that's incredibly time-consuming, has no value added, and it seems antithetical to trying to get prior authorization. What I really am getting.
Okay, so that's interesting. So most of the doctors that I work with, at least here, and I don't know if it's just, it varies from medical group to the type of insurance company that you have, but most doctors that I personally work with, they can do it electronically. So this is interesting that I wonder if, depending on your area or depending which insurance provider that the client has, that is how they're managing it. That is really interesting. And that's a disgrace.
As a prior authorization to get a prior authorization.
Yeah, and everything about that sounds like a nightmare, including the presence of the words fax machine. I thought we'd stopped making them around the same time that we stopped making good romantic comedies. In fact, I think the last time I saw a fax machine, a frazzled Michelle Pfeiffer was getting horned up for George Clooney. Remember that?
That's funny.
Good romantic comedies, the kind of films that feel like a blanket and make you leak from all your holes? What happened to this country?
Oh my God.
Anyway, as you might guess, Medicare Advantage providers partly or fully deny millions of prior authorizations each year, and that can be maddening for those who need care. Take what happened to Gary Bent. He had significant complications from brain surgery, including being unable to stand or walk on his own. His doctors said he needed a lengthy stay at a highly skilled rehab center. Now, under traditional Medicare, that would have been covered. But he had a Medicare Advantage plan from United Healthcare, which only approved him for a few weeks.
I love how they keep aiming at.
And
Well,
Gary's
the
wife
thing
and
is,
daughter
I mean, they're
remember the
under
advice
hot
they
fire
got
for a
from his care
reason,
team
like,
about
and they
trying
do need to be
appeal
called
United's
out.
decisions.
They told me
They do need to be called out, because how are we going to get better for our clients if you pull these practices?
The speed with which these denials came would increase. They would be fewer and fewer days apart, and eventually I was going to lose.
We felt like this process was designed to wear us out, and I would say it did wear us out.
Yeah. And that's exactly what happened. They won 2 appeals, then lost a third after an external reviewer sided with the company. While United Healthcare insists it was just following Medicare guidelines, Gary was sent home before his family felt he was ready, with, by the way, a fever and neck pain. And within 11 hours of being discharged, he was rushed to the ER where he was diagnosed with meningitis. And that was just one step in a quick decline towards him dying the following winter, a decline that his wife says was made worse by the added trauma of having to fight for the care he needed and was entitled to. And there are something so awful.
Okay, and I can absolutely understand why they don't want to disenroll, because the 20%, and I hope he makes this comment. If he doesn't, I'll make it here. If they were to disenroll from that plan, and him having the amount of chronic conditions that he had, if he didn't have his state's Medicaid program, I mean, that 20% bill from the hospital, like, it would have eaten them alive. It would have eaten them alive. The deductible plus that 20%. I can understand why they're like, they're caught between a rock and a hard place. And the sad part of it is this is not uncommon. This is not uncommon. It is definitely one of those moments where I hoped and wished they would step back and say, like, listen, we're talking about this now because, you know, this family was put in a position where their insurance plan failed them. We need to take a step back and say, you do know that 20% of a $200,000 bill is astronomical for a person to pay when they are that deathly ill. If you don't have those savings, you literally are going to burn through all your assets. It's what happens with traditional Medicare. Yeah, you don't have prior authorizations. Are you going to pay that 20% bill? And when most people are like, ask me, you know, what is that 20%? I don't know. I don't know how much a hospital is going to charge you. I have no idea how much a doctor is going to charge you. No clue. You have to call them. And are you really going to call them and ask him how much is your bill because I need to make a 20% calculation? No. No one's going to do that.
It's almost impressive to be able to make them worse. It's like seeing a Cybertruck
but this
with
is sad.
Diddy's face painted on it.
That is really sad.
I don't know how you managed to do it, but I like this even less. And the thing is, delaying, underpaying or denying care doesn't just hurt patients, it hurts hospitals too.
Correct, it does.
Particularly those in rural areas.
It does.
They don't
Correct.
have the time or resources
It does
to
hurt
sink
them.
into constantly appealing decisions, which has had real consequences.
This was once the geriatric psychiatry unit at Alliance Healthcare in Holly Springs, Mississippi. Now the hallways hollow and beds sitting empty.
This operating room only a few years ago was doing 5...
And hospitals are not a fan. They're not a fan of Medicare Advantage plans. They're not. I don't blame them either. And this is where, you know, we need to do better in setting up contracts and having open relationships with the insurance companies. Hospitals, clinics, you know, other additional services, skilled nursing, home health care, hospice. All of these organizations need to have open communication with insurance companies, because this is what's going to happen. It's happening now. It's going to be exasperated because, like he said in the beginning, it is projected that 2/3 of Medicare eligible people will be on an Advantage plan. There is no other choice here. This is what's going to happen.
6 procedures a day. Now, 0.
Dr. Kenneth Williams is the CEO. He says the hospital can no longer afford the unit or any inpatient care for that matter.
All of this used to service people that really needed help, and now it's just totally empty.
It's empty, it's gone, and it died the last few years with Medicare Advantage.
That is terrible. Thanks to Medicare Advantage, that whole wing is now abandoned and, by the looks of it, already haunted, because at any moment it feels like Jigsaw's about to...
Oh man, I want to cry. That's devastating. What I want to learn, or what I would like to see, is how much would it cost our government to cover things at 100%? Like, how much more would it be? Would it come out to be the same thing if they just were to cover the 100%? Because then the deductibles would all be met. And we talked about this in a previous video. I don't know if it's uploaded yet. But I think with the BBB, I did say this in that video, that there are 6 states in 2026 that are introducing prior authorizations in traditional Medicare. They are implementing it as a pilot program. Prior authorizations are coming to 6 states for those folks who have traditional Medicare A and B. And if you're introducing prior authorizations, then pay it at 100%. Why 80? Pay it at 100%. If you're going to do prior authorizations, you might as well pay 100%.
Pop out with a realtor to just check out the space. And even hospitals which haven't had to close wings have stopped taking these plans, with a 2023 survey finding nearly 20% of health systems had stopped accepting at least one Medicare Advantage plan that year alone. And if you're thinking, well, you know what, that's okay. If I get sick and I need a specialist, I'll just switch back to regular Medicare.
Happened in San Diego with Scripps.
Because remember, it has that 20% gap that you need to cover. Now, when you first enroll, it's easy to buy a Medigap plan to do that because they can't hold pre-existing conditions against you. But in most states, once you've enrolled in a Medicare Advantage plan, Medigap insurers are allowed to reject you based on them. So as a practical matter, once a patient enters the Medicare Advantage system, they typically can't afford to leave. Think of it like Scientology or a beanbag chair.
Oh my
Easy
God.
to get in, very difficult to get out. And when you take all this together, you get a system where the incentives are clearly set up for insurance companies to make you look as sick as possible on paper, while doing as little as possible to help you when you actually need it. Now, the industry is going to dispute that. They've even funded their own studies suggesting their plans actually save the government money and deliver consistently better health outcomes than traditional Medicare. Though, when Stat News asked more than a dozen leading health policy experts to review a bunch of those studies, they found they had fundamental flaws and obvious biases, and on the whole were so skewed, they basically constituted an alternate reality. And look,
I am not surprised. I would say I would like to see which they keep bringing up the one company over and over and over again. I'm like, and I get why, because that one company is under really hot water. It's under really hot water. And yes, we should hold them accountable. 100%. We should hold them accountable. And it's a company that, that I represent, that I offer to my clients as well, because they ask for it. If and I say this and I put the disclaimer and everything, like, I represent 16 different companies. I'm licensed in multiple states. And if a client wants a particular product from a particular company and they don't want to see anything else, I have to comply with their wishes, because that is my fiduciary responsibility to a client. With that said, I always tell my clients through and through, you signed a contract. Same with the insurance company. They're giving you a contract that they also have to comply with. And when they're not complying, this is for any insurance company that you end up signing, yes, take care of me. You can demand, why aren't you not complying with the contract? And I always tell them, if you end up getting a bill in the mail and you know what your co-payments are, if you know what they should be covering you for, give me a call. If they're not complying with the contract, then they're not holding up their end of the bargain. You need to hold them accountable. That is the only way we can get things better. But I get it. As he said before, people get boggled down. That's why you need to know your market. You need to know the alternatives, because you have to go where folks or industries will treat you best. Always go to where you are treated the best. You're going to get so much marketing thrown in your face that looks like, this company is selling you a Lamborghini. Please do your research. Go with a trusted broker that knows your industry.
If these companies are living in such a dangerous fantasy world, they clearly need professional help. Luckily, I happen to know a board-certified therapist who can see them, but bad luck, he's out of network, so fuck you! So what can we do here? Well, as I've said before, so many of these problems would go away if we had single-payer healthcare, and we could get closer to that by making regular Medicare more expansive and easier to navigate, and getting rid of that 20% gap in coverage. But
Thank you.
We should at the very least be calling Medicare Advantage by a different name, and ideally one without the term Medicare anywhere near it, because as you've seen, they're just not the same. It's like the difference between a flashlight and a fleshlight. Sure, they might sound similar, but they do drastically different things. Unfortunately, though, it is tough to talk about potential reforms right now, given who is in charge of Medicare currently, because in case you've forgotten, it is this fucking guy.
22 across, 8 letters.
Oh my God.
M. A government entity dedicated to the health of seniors.
Memeras. It's Medicare.
Memeras fits.
It's Medicare.
Well, guess what? I work for you now. Yep, they put me in charge of Medicare. Now, how cool is that?
Not cool! Not cool at all! And it is just wild to see someone who's been on TV for 2 decades give the single worst line reading I've ever seen. And remember, we just watched these two go to town. One of the many reasons it's not cool is that Dr. Oz not only promoted Medicare Advantage in sponsored segments on his TV show, he once co-wrote an op-ed titled Medicare Advantage for All Can Save Our Healthcare System, basically suggesting that we roll it out for everyone. And while he's recently acknowledged some of the problems that I've mentioned, he's also said the administration wants to give insurers an opportunity to voluntarily fix them, which I would say is the most ridiculous thing that he has ever said, except he did once do this.
So that's what you call...
Okay, so So a couple things. I'm glad he made the comment about the 20%. Get rid of that 20%. I want to see how comparatively, it fixes it. But it doesn't fix the fraud. As I mentioned here before, because there's no oversight, people can just bill Medicare like crazy. If you think the insurance companies are bad, folks who just take straight Medicare, not all of them, but there's been some interesting billing over the years for those who just have traditional Medicare. The other thing is our country is too sick. If you look at socialized healthcare from countries that have had it installed for a minute now, I'm talking about South Korea, Japan, the UK, Germany, France. When you look at these countries who installed their socialized healthcare, one of the things that really folks don't understand is how sustainable is it? And why does it work for them but not for us? Well, when you look at their aging population, and those aging populations are much healthier, extremely healthier than the folks here in the United States. We have probably the sickest first world population amongst all of the first world countries. That's one. Our folks here, because of our food and our dietary, absolutely just, there's no comparison. We are the sickest first world country. Two, the aging population there, not only are they much healthier and they have healthier habits, but two, their countries are now sweating bullets because the way that you maintain socialized care is that you have to pay into it by a healthy working population to support the aging senior population. If we don't have folks paying into the system, paying taxes into the system, and here how we love to give tax breaks to those who make an astronomical amount of money, we legitimately could not afford Medicare for all because we have an unhealthy group of individuals. We have the most unhealthiest group of individuals of any first world country. And two, we continuously give tax breaks to those who hit a certain tax bracket and above. So how do you expect that these other first world countries who have a much healthier population are struggling and they're trying to scramble to find ways to pay for the healthcare needs of their retirement class with their healthy, populations? How do you expect that for here? So we're most folks who work in this space are keeping a close eye on South Korea and Japan because they're already seeing the downfall of their socialized care. They're looking at Germany, France, and UK, and all of Europe, and they're seeing their struggle with socialized care with Canada. Just saying.
A camel toe. Yeah. Can I actually show you what camel toes look like?
Of course.
Okay, so here's a picture of what a real camel toe looks like.
Television was a bad idea. So, look, at the policy level, for now, we are kind of fucked. But in the meantime, if you or someone you know is considering one of these plans, first, if you can afford to buy a Medigap plan and enroll in traditional Medicare, you should do that. But if you can't, you should at least understand the potential drawbacks of Medicare Advantage.
Correct.
And whatever you do,
100%.
Do not call those broker numbers on TV because they won't give you unbiased advice. They get much higher commissions if they funnel you to Advantage plans. So if you want independent advice, you can call your state health insurance assistance programs.
Correct.
You can find your
call
state's
them,
number
yes.
at this website. And while I know
Yep.
it is basically
shiphelp.org.
impossible to escape these ads right now,
Yeah.
we thought the least we could do is provide one for you that is technically accurate.
Did you make the call?
What call?
Feldman said we may be able to get additional benefits with Medicare Advantage right here in our own zip code.
Our zip code?
Yeah, the zip code we live in.
Okay, so here's some of my final thoughts on John Oliver's Medicare 101 and his PSA about Medicare Advantage plans. Like I said, you know, I am a licensed insurance agent. We've covered that. And I'm glad that he brought up, you know, oh, don't call these numbers. They are incentivized to guide you to a certain, you know, plan because they get paid. I don't know about those plans. I don't know about those commercials, I should say. I don't know about those commercials. But I will say this, and I made a post about this the other day on my LinkedIn. 40 to 45% of my clients either have asked or have joked about that I am bought, right? I am a licensed agent. My fiduciary responsibility is to you, the client. I try to keep it as straightforward as possible and assess the client and what is best for them. And if what your needs need to be met. Now, if you sign up for an Advantage plan, you can always disenroll. That is always your right. You can call the company and say, like, I'm out. I want to go back to traditional Medicare A and B. That is your right. You can do that. What I would say is be careful. If you don't have your state's Medicaid program, here for California's Medi-Cal, you should know how much you're going to pay. That's it. You should know how much you're going to pay and what you're going to gain and what you're going to lose. So what I tell most folks is you have to pick the plan that is right for you. You should always have someone guide you through the process as unbiased as you can possibly get them. And I agree, if you can afford a Medigap plan, a Medicare supplement plan, a MedSup plan, all the different nicknames for it, absolutely get it. Get it. You can go anywhere, you know, you don't have to worry about that 20%, they'll cover it. There's all types of, there's 8 different types of Medigap plans. So when it comes to traditional Medicare, if you cannot afford a Medigap plan, I agree. You need to know what you're getting and what you're losing. What is most important to you, and make sure you know that you're not a slave to one plan. You can always change your plan. But you make sure you have somebody that you trust, who knows your community, who knows your environment, the relationships between different hospitals, different doctors, different clinics, different urgent cares, you know, any of the healthcare services with the insurance companies. For the most part, this was so much fun. I loved this. I love John Oliver. I think he's fabulous. Again, as I said, whenever any of these late night talk show hosts take a gander at my industry, I am over the moon. Like, thank you so much for spotlighting this. Thank you so much for putting, you know, holding up a spotlight. I know my industry is broken. That is not lost on me. I know. But I want my clients to win. If this game is rigged, then I want to rig it for my clients so that they're the ones that win. Okay? That's really what it comes down to. And as always, you know, if you liked this type of video, if you liked, you know, having this type of reaction video to John Oliver, let me know. I hope you took something away from this. I hope you learned something about our history here of how we got here in our healthcare industry, our commercial insurance industry. Medicare's been around since 1997. That is the last thing I will land on. Prior to 1997, you know, most people bought commercial insurance to make up for what Medicare lacked. That's why Medicare Advantage was born, because our senior population couldn't afford that 20%. And they had to go and buy a separate private insurance policy to help pay for that 20%. I understood, they thought, oh, why don't we combine the two together so that you don't have to worry about that 20% and you get your dental, vision, hearing, and extra goodies. I think hopefully in the future, whoever watches this, hopefully a politician or someone, up in the clouds of DC, if you end up watching this, I hope, this plants the seed of what we could do, what could be done for our country and what we can do for our own citizens when it comes to healthcare. Because I really hope I'm well taken care of when I turn 65. But that's, I guess, my soapbox for myself. Again, if you like this kind of video, if you liked this type of information, please leave a comment, like, subscribe, share, and I hope to see you on the next one. Oh, yeah, and if you need someone to review your 2026 plan, feel free to schedule an appointment with me. I would be more than happy to go ahead and review your plan for you and see if you're on the right track. Thank you so much, and I'll see you on the next one. Bye-bye.